like in the case of rape, sorry to say that, but in the case of rape, if the woman does not want the child, she has a choice not to want the child.
You are not the only one thinking like this that has this opinion. Plenty other people. As I am saying this about contraceptives, and see some people who just look at me and just hiss because they don't want to hear contraceptives.
Because what is conception? Conception, because contraception is you are preventing conception from happening.
Well, a study have shown that contraceptives are safer than pregnancy. Contraceptives are safer than abortion. Contraceptive can make you gain weight, irregular bleeding, or excessive bleeding, or your mood might be changing. What other cancer? It will interest you to know that some contraceptives actually prevent cancer.
Welcome back to my channel. How are you guys doing today? Today I have an amazing guest and you'll get to know him pretty soon. If you're new here, do not forget to subscribe, share, and leave me a comment in the comment section. I would love to hear from you. Today we're speaking about something very exciting, and it's about contraceptives. Yes, and Dr. Paul here is going to be sharing with us his own personal story about contraceptives. So wait until the end.
Yes, because I'll talk about it toward the end.
That story, and you want to hear it. You sure want to hear it. All right. Let's get started. What do you do?
Okay, so I am Dr. Paul Anejudo. I am a medical doctor and have served, and I am practicing now as a medical officer. Okay, so I'll still get into my postgraduate studies, but for now, I work in a mission hospital as a medical officer.
Yes, and guys, an interesting fact, we're actually classmates back in high school. And it was our senior boy. You guys know what that is?
She used to be very quiet, come to class, read your book, close,
you
go
think
home.
So? It's interesting what you remember, right? Anyways, let me know if you know what senior boy is. If you're Nigerian, you probably do. Let's know in the comment section. And if you're not Nigerian, let me know what you think senior boy means in the comment section. All right, so tell us, what is contraceptives? What does that word even mean?
Okay, so contraceptives are agents that prevent pregnancy. The drug can be a contraceptive because it prevents pregnancy. But the broad term of it is family planning. Okay, yes. And the family planning is a way of living. Okay, that is adopted by individual. When you say a way of living, it's like to say it's a culture that an individual or a family or a couple has adopted voluntarily with responsible decision in order for the welfare and the health of its family members, and as well to contribute responsibly, socially to the society at large.
Wow, that's a lot of encyclopedia, isn't it? You just gave us that big definition. Now you have to break it down to us lay people, right? To lay people, yes, so they understand what that means.
Yes, now in medical terminology, the words are usually very selected because if you miss a word, you fail exam. So we just cram a lot of words. When we say that it's a way of life that is adopted by individual, that means that I alone can decide that I want to adopt family planning. I mean, I'm single, I don't want any kids, so I'll do family planning. That does not interfere with my sexual life. I mean, for a woman who has the chance of getting pregnant. So that has to be individual.
I like how you said a woman. So are you saying a man can do family planning?
Well, a single man will not bother if he's going to have a child. Yes, but a woman is the only woman that can conceive, right? So she can decide on herself. So if I'm having an affair with a lady outside and I'm single, or the lady don't want to get pregnant, so she can make that decision on her own without my knowledge. Do you get that? That's why it's individual. But for a married couple, it has to be by a decision made by couples. So that's why the definition said that individual or couple. Okay, so it's a way of life, a way of living that is adopted by them voluntarily, because the healthcare worker will never force you or compel you to do it. You have to be voluntary decision made by you, and it has to be responsible. Okay, so you be responsible with it, whichever method and how you go about it, the consequences, you take responsibility of it, because all this is for you. And what is the reason? That is the reason for it is what is actually entailed to in the definition, when it says that for the health of the family and welfare of the family. I cannot have 10 children. You know, this economy is not possible. So that's welfare. I'm looking to welfare of my family. I have 2 children. This is the only I can care for, so I don't want more kids. So my wife and I can decide which method to use. All right, and also to our health. If my child is sick, I should be able to take to hospital for hospital care and treatment. You also contribute to the social development of the society. This is where we talk about population explosion, that we are overpopulated, food shortage. When everybody is using family planning, only can give birth to what you are capable of taking care of, then that will reduce poverty really and starvation in the community.
Wow, I like the rich, robust way you really just broke that down to us. Let me divert your attention a little bit. So I've worked in a conservative setting, in a practice where people believe that, you know, the Bible says, what's that Bible verse?
Refill the earth.
Yes, you know,
multiply
and all that stuff. Like, why should we plant something that God He gave us freely? Like, you could just procreate. So why should we plant it? Are we saying we know better than God? Or what's your personal opinion?
Okay. God said that we should fill the earth. The question to you is that, is the earth filled or empty? No, I think the world is filled. There are a lot of people in the world that the world can even occupy itself. So that's one question to you. Another question to you is, God give us brain, right? So all the knowledge that we acquire in medicine, in science, they are from God. All these contraceptives we want to talk about now, God gave people knowledge, wisdom to be able to come about it and forward for the benefit of humanity. So, and put that aside as well, another common sense is for me that I'm earning 120,000 per month to have 10 children. I went to Babcock University and my school fees at the time was 3.5 million. So imagine if 12 of my kids, I have 10 children and 2 of them want to study medicine in Babcock University. With my 100,000 salary, I mean, I can't even feed them, clothe them, so you need to take responsibility of what you can take care of, what you can care for. So we cannot just take spirituality about it. No, we need to apply wisdom, because God has given us the thinking faculty.
Wow, that's amazing. Thanks for sharing your personal.
Yeah, that's my personal, yes. It's good you emphasize on it.
Thanks for sharing. Let us know in the comment section
what you think
about having lots of children. I know I've worked with people that do have, and they take responsibility. I've worked with some that take very good responsibility, financially, mentally, spiritually, for their children. And of course, I've also seen people that do not. And those children become the responsibility of the church, the community.
Or they are begging outside.
Or they're begging, which we have a lot of them here in Nigeria.
Yes.
There are lots of people that just beg on the road, children, or they're doing child labor and things like that.
Another thing people do, some couples, if they know that they are capable of having 2 children on their own to take care of, they have 2 children, they will now say that, let's just make our family of 4 children. And by doing a charity deed, I will say it, by adopting 2 more. Because there are people outside who need parents, there are people outside who need love, who we can extend to. Some people get married and say we want to adopt kids. So whichever one you want, but I mean, I know how adoption sounds in African ears. So if you don't want adoption, if you want 10 children, go ahead and have them. But be responsible for their health and their welfare. If you can take care of them, why not? I mean, God has blessed you. Praise the Lord.
Absolutely, absolutely. So guys, let us know what you think about this subject. It's a very sensitive one in the comment section. We've shared our own personal opinion. We'd like to see what you guys think in the comment section. What are the types of contraceptives that we have?
Well, yes, we have classification of them really. Like we have the natural one, natural method, hormonal method, that means hormone. And then we have surgical methods that are also used. So, and there's one they call the barrier, barrier method. So I'm going to talk about these things. But the first one I would like to talk about, long-acting reversible. Long-acting reversible. That means that the contraceptives, they last longer and you can reverse it. If you don't want it again, you say, I don't want it again, and they will take it out. Example of that is the copper T, right? Yes, it's copper T that we put inside the uterus. That one can last. It depends on the type. We have one that can last for 3 years if you want to wait until then, one for 5 years, and one for 10 years. So you just talk to your healthcare worker and you give you the disadvantages and advantages of which one and help you to choose which is best for you after assessing you. Another one is the Implanon. So implant it is like a matchstick, like a stick like this that we put under the skin. You just implant it there so that it releases the hormone gradually, and that can last for at 5 years as well. So this one are long lasting and they are reversible. So for about 10 years, 5 years, you don't need to worry that you are going to get pregnant if you are sexually active. All right, so those are the good benefits of that, and they are very, very, very good. They have 99% of success rates. I mean, can you imagine that?
That's nice. It's a big number.
It is. The next one I'll talk about is the hormonal contraceptives. These are hormones, mimic the human hormones, so they are synthetically produced. So they could come in the form of pills that you swallow or the form of injection. So if it's pills, you have to be taking it every day, and if you miss a dose, you have to take it or use another method again, we call emergency oral contraceptives. Also the injection one you can take every 3 months. They are the one you can take every 3 months. They are hormones that are injected into your system, and they help you from producing egg. I mean, that's the function. Because
So sorry, can I ask you a question?
Sure.
So how is Implanon not hormonal since it's an hormone?
Well, Implanon, as I said earlier, that it's also an hormone. It's a hormone that is inside that stick, yes. So we put it under long-acting contraceptives because it lasts longer, just as the classification. It's just still part of the hormonal. It's just that it's not pure, it's not injection, but it's inserted under the skin. So yes, really, it's hormonal as well. So, but this hormonal I'm talking about here now is the pills or the injection. The pill you take every day, the injection every 3 months, you can come for it. Also, before you choose which one to use, you talk to your healthcare worker. They will assess you and see which one is fit for you, which one is best for you. They will help you with the decision making because they will not make the decision for you, as I said earlier. So it's a voluntary decision and you are responsible with whatever comes from it. All right, so I also talk about the barrier method. Of course, you know what this is, as the name, like a barrier. That means you are not doing skin to skin.
I love how you said skin to skin.
So these are condoms. The man will wear his condom, and if you want, the lady can also wear their own condom. there are ladies condom that you can wear, okay? We also have diaphragm, cervical cap, all of this that you use. So you can choose those if you want, the barrier method. As I said earlier, you also talk to your healthcare provider to choose for you which is best for you, and to also want to know how long you want to give yourself space, to also determine, and your physical health, we also check to be able to know which one is best for you. We have emergency, like emergency contraceptives. These are used when somebody go crazy and have sex without protection.
Why do you think? Do they have to go crazy?
I mean, I don't see any reason why somebody will have sex without protection.
Unless
protection.
They just want to have kids.
And then later they rush to you and say, we had sex and I didn't use protection. What should I do? Anyway, what I'm trying to really drive at here is that when you are with a lady, a man is with a lady, and the hormones are being released, the thinking faculty is suppressed. So they are not thinking well again. Some of them is after they are on top of each other before they remember that, hey, condom. And they realize there's no condom. Go and buy condom, I can't wait. They just do it. And then when after they have done it, everything has relaxed. Their eyes now open up. God, I don't know this girl. I will just do this thing like this. So they will run to hospital. We have seen some of them who run to hospital. And some of them is that the condom burst. The condom burst and they cannot remove it and stop. They must end it. That kind of thing. So after they have ended it, they come to the hospital. Some of them are rape. Okay, case of rape. So they very sad. Sorry to say that one, but it's happened.
It happens. Yes.
So when they come, there are emergency oral contraceptives that we can give them so that they will not get pregnant. Of course, we also treat them prophylactically for some sexually transmitted diseases. There are treatment pattern in which we follow, but I'm talking about contraceptives here. So we'll give them pills. There are some pills. They take two types of hormonal pills. Of the hormonal pills, they take one at start. 12 hours later, they take another one, and that's just it. Another one and these pills must be given 72 hours within the time it happened, because after 72 hours, say somebody who had this incident about 3 days ago, the chance of working for the pills is very, very minimal. So if it within 3 days ago, really, it's okay. But anything hours to 3 days ago, it may not be very effective. However, there's still option. You see, science is very beautiful. We are trying to make life very good for you. So even if your own has passed 3 days ago, we'll now bring another option for you. Okay, that is the copper T. The copper T I talked earlier before that I said that the one we insert into the uterus, it can be used as emergency or contraceptives. What we do, if we ask you that when was the rape, and you say 5 days ago, okay, we'll say, all right, you cannot use the pill again. The next one you use now to insert the tube. So the tube have the capability of preventing pregnancy even after you have sex about 5 days ago. So those are the emergency ones.
Do we want to have this conversation? This is a raw conversation. Yeah? Okay. From my background of my training, I think that contraceptives, all of them, except barrier, has a lot of side effects that is dangerous for a woman. And I'm like, why would you have your wife do something like that could cause breast cancer, that could cause ovarian cancer, that could cause lots of cancers? They grow fat because it makes them grow big, add weight. Some of them are bleeding every month. They have lots of mood swings. They have headaches. The way it affects different women are different because our body constitution are different. So why would I
suggest your wife or your patient to such situations?
To such things. I would rather teach natural, calendar method, which I know people say it doesn't work.
Yes, there is calendar method. I have not reached that part too, but she already brought it.
And for me, I think I would rather teach that part. Right now, I'm trying to get to know myself and my cycle and how it works. And I know, of course, stress and maybe you move to a new place, weather, whatever, could, just maybe you're supposed to ovulate today and then you ovulate next week, or you ovulate earlier because of those things. Things like that can happen. I'm more of the mindset, like, why don't you get to know your body and then watch the calendar and, things can still happen. You're still going to share your story with us.
Yes, please stay with us because the story will come.
Yes, and so I'm into like, why share these things that can cause a lot of this crazy stuff instead of going the natural route. Like in the case of rape, sorry to say that, but in the case of rape, if the woman does not want the child, she has a choice not to want the child. Because what is conception? Because contraception is, you are preventing conception from happening. And so conception is when the egg and the sperm meet. Even though it's not a baby, it's a life. That's it, period. Whether it's at 20 weeks is when you call it a life, or when the baby is born is when you call it a life. It doesn't matter. God has given this child a life. And so, I don't know. Yeah, so this is my other part of me, and I'm like, are we ready for this conversation?
God, you are not the only one thinking like this that has this opinion. Plenty other people. As I am saying this about contraceptives, and see some people who just look at me and just hiss because they don't want to hear contraceptives. But a study have shown that contraceptives are safer than pregnancy. Contraceptives are safer than abortion. Yes. So I will say that again. Contraceptives are safer than pregnancy. Contraceptives are safer than abortion. The aim for contraceptive is not for abortion, but as she said, fertilization has already taken place, so there is life being formed, developed already. Okay, so I will agree to some extent. Yes, in that case of rape, where a girl comes 5 days later, some sort of fertilization could have taken place, that the chemical will just go in there and disrupt everything. There's possibility of that. But aside that, for a family who planned, for family planning, it is not an abortion at all. For family planning, it's not an abortion. Because you have like family planning clinic, you plan it. So there is no egg meaning the sperm at all. Yeah, that's like prevention, Yeah. But in the case of rape and emergency contraceptives I talk about, it's for individual decision, and it's also for the doctor who is attending the patient to help take out the babies or terminate the ongoing event already, or refer to another doctor who is more convenient to do it. These are a matter of faith and ethics, and as much as possible it doesn't interfere with our work. If it interferes with my work, I will stylishly refer the patient to another person who find it very comfortable to do it.
And we're not judging here. One person might be okay doing one thing, another person might not be. I've seen a family that had a deformed child, and they were with the opinion abort the baby or have the baby, and the baby still dies a week afterwards. So those are things that it's not easy, to make a decision, but...
Right, and one thing you said that skipped my mind, but is back, is that contraceptive can make you gain weight, irregular bleeding, or excessive bleeding, or your mood might be changing. What other cancer? It will interest you to know that some contraceptives actually prevent cancer. Some of these hormonal things prevent ovarian, breast, and endometrial cancer. If you read about them, you're actually going to know. This is why I told you that you cannot do it by yourself. You need a healthcare physician to help you. So those who are at risk of developing cancer, because she's right, and some of them cause cancer, yes. So those who are at risk in having cancer, we will not give them some certain one that will cause it. That's more I know.
When I was in Abuja, I was learning it. People like, don't say it, it's your accent. Like they won't learn now. They will laugh and laugh and laugh. I'll continue speaking.
learn another language.
Abi now. Yes, Abi, I'm small.
Make you dey learn am, you go master am.
Yes, so. You know when brothers used to speak, you just come from Lagos. Wish I can speak.
If you have friend from Warri, na dem sabi am pass.
I thought it's Lagosian.
Warri people, it's pidgin dey fit speak.